My target group were middle school children ages 12 to 13 in the 6th and 7th grades. My objectives were 1. Given prior information on tuberculosis, students will conduct research via the internet and write at least one page explaining what they feel is the main cause of TB. Students will also cite 3 reliable sources they used to help develop their paper. 2. Given the opportunity to work in pairs and previous lessons on how TB is spread, students will be able to demonstrate through live role play at least 2 ways that TB can be spread. And 3. Given previous lessons on the spread of TB and its prevalence, students will be able to formulate a health plan for someone who has TB and for someone who does not have the disease but may be exposed to it. And due to time, we're just going to focus on the first 2 objectives for this lesson. So what exactly is tuberculosis? According to the CDC, tuberculosis, also known as TB, is a bacterial infection caused by Mycobacterium tuberculosis that attacks a person's lungs. TB is considered to be the leading cause of death from infectious disease. Mycobacterium tuberculosis, MTB, is a rod-shaped bacterium, also known as Koch bacillus. MTB was discovered by microbiologist Dr. Robert Koch in 1882. He received the Nobel Prize in Medicine in 1905. There are 2 types of TB infections. There's latent TB infection and TB disease. So latent TB infection is when tuberculosis is able to live in a person's body, but it doesn't make them sick. Now, usually most people can fight off the bacteria and stop it from growing inside of the body. So those infected with latent TB, they can't spread the bacteria to others. However, TB disease is when the bacteria is now active in the body and it begins to multiply. So these people with active TB disease will have symptoms and it can spread to others. Mycobacterium tuberculosis is a small bacterium that lives only in people. It's considered an aerobic bacterium, which means it needs oxygen to survive, which is why it's not found in non-living things. And here's a picture of Mycobacterium tuberculosis. You can see how it's rod-shaped and there's so many different pieces. TB has been around since ancient times, dating back from 15,000 to 20,000 years ago. It's been found in ancient Egypt, China, and India. Archaeologists detected Pott's disease, also known as spinal tuberculosis, in ancient mummies. During the Middle Ages, there were records of tuberculosis infecting the cervical lymph nodes, aka scrofula. In the 18th century in Western Europe, TB was at a high, 900 deaths per 100,000. This was caused by malnutrition and poorly ventilated housing. So what exactly causes tuberculosis? In order for a person to become infected with TB, they must first be exposed to it. Tuberculosis is an airborne disease, meaning it can be spread when droplets of the disease are expelled into the air. In order to be exposed to it, a person with an active case must expel it from their body by either coughing, sneezing, or talking. And then the non-infected person then has to inhale the droplets that contain the TB bacteria. If it's not treated properly, the disease can be fatal. Some symptoms of tuberculosis are as follows: a cough lasting 3 weeks or longer, chest pains, coughing up blood or sputum, weakness or fatigue, weight loss, no appetite, chills, fever, and sweating at night. As stated earlier, TB is easy to obtain because it is transmitted through the air. For those already infected, the best ways to prevent spreading the disease are by covering your mouth and nose when sneezing or coughing, taking all medications required, and those with a latent infection should take medicine to prevent it from turning to an active case. There is also a TB vaccine, though not everyone gets it. And for those not infected, if you feel you may have been exposed, get tested right away. Because as I stated earlier, the longer you take to start getting treatment, the more fatal it can be. Now, there are some risk factors. People with medical conditions and already possessing a weak immune system are at risk. You also have a higher chance of getting TB disease if you have an HIV infection. A child 5 years of age or younger is higher at risk. Cigarette smokers and alcohol drinkers, as well as other drugs. If you live or work where TB disease is more common, such as a prison or a healthcare facility, you are at risk. And if you've spent time with someone who has TB disease, you are at risk as well. Now, treatment. For those with latent TB, treatment can be much easier. They're more likely going to be given medicine to prevent them from developing the TB disease. Some antimicrobacterial medications used to treat latent TB are isoniazid, rifampin, rifapentine. Treatments for those with TB disease include isoniazid, rifampin, ethambutol, and pyrazinamide. Now, this is just a slide that I threw in there. Their trends in tuberculosis. It's the reported TB cases from 1982 to 2013 in the U.S., but it was updated in July of 2014. Now, I know we're in 2015, but this just gives you, an understanding of the reported TB cases. Just remember there are ones that do go unreported. And you can see it's significantly dropped over the past years. It was at its peak during 1993. I wonder why. So this was just something else I wanted to add in there. Now, on to our assignments. Focusing on Objective 1, after having gone over this PowerPoint, you're going to now do Objective number 1. And remember, aside from this PowerPoint, you can use the internet to develop your paper, and you'll be graded using the rubric that is followed on the next slide. Now, the rubric's pretty simple. You get a total of 15 points. The first 5 are awarded if your paper is properly formatted, single space, Times New Roman, 12-point font, full page. The next set of 5 points are awarded if you properly identify what you felt was the main cause of TB and why. And the remaining 5 points, you just need to cite your 3 reliable sources in the paper along with a works cited page. Objective number 2, I'll divide the class into pairs, and you'll take 15 minutes to develop a skit. And that skit, basically, you are going to, each person needs to demonstrate 2 ways TB can be spread. Overall, you'll be graded for meeting the expectations and the length of the skit. This second rubric, as well as the first, they're pretty straightforward. This one, you're awarded a total of 14 points. The first set of 7 points, each student needs to be able to identify 2 ways that TB can be spread without verbally saying it. So, the audience that's watching needs to be able to realize, okay, Alan gave Tony TB because he sneezed on him. Or Tony gave Erica TB because he coughed on her. Stuff like that. You don't have to, if you sit there and say, oh, I just coughed, then you're going to get a deduction of points. And your second set of points will be awarded. The skit needs to be no shorter than 5 minutes and no longer than 7 minutes. Pretty straightforward. This has the end of my presentation, so thank you.